I verified my orders. I'm checked all my supplies. All the packaging looks good, intact. Nothing is expired. I have done my first check at the Pyxis. I'm now going to go ahead and enter the patient's room. Hi, how you doing today? My name's Jason. I'm going to be your nurse. Is it okay if I set my supplies down on your bed for a moment?
Yeah, go for it.
Great. Can you tell me your name and date of birth?
Ivy Armstrong, 3964.
Okay, Ivy Armstrong, are you allergic to anything?
Latex.
Okay, wonderful. Well, I'm going to be inserting an NG tube today. It's going to be going up through your nose and into your stomach, so it's not going to feel very good, but I'm here to help you through it. And before we can go ahead and do that, though, I need to administer some medication to help you with the nausea. And that's going to be 4 milligrams of ondansetron. So if it's okay with you, I'm going to go ahead and get that started. Okay. Okay, let me get my supplies here ready. Ivy, I'm going to go ahead and raise up your bed, okay?
Okay.
I'm going to lower this down. Sit you up there. Need you at least a 45-degree angle here. Is that okay for you?
Yeah.
Okay. Now I'm going to be giving you an intramuscular injection here into your arm. And let me go ahead and get this medication ready. Okay, so we are administering 4 milliliters of ondansetron. I'm sorry, 2 milliliters. And I'm gonna draw up 2 mils of air first. Okay. I'm gonna inject that into the medication vial. And now I'm going to draw up 2 mils. Go ahead and put my safety on. And I'm going to dispose of my sharp. before I administer the injection, I want to go ahead and cleanse the skin, the area that we're going to be injecting. So I'm going to cleanse this for 30 seconds. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 14, 15, 16, 17, 18, 19, 20. 1, 2, 3, 4, 5, 6, 7, 8, 29, and 30. Give that a second to dry. Okay. If I were giving this in the deltoid, I'm going to go from the acromion process 3 fingers down. So I would pinch the skin right about here and administer the injection. And I'm going to demonstrate that over here. Pinch the skin, intramuscular, 90 degrees. And we're going to administer. Take that out, put my safety on, dispose of my sharp. And we're all done with that part, Ivy. How do you feel?
Ouch.
Okay. Well, hang in there for me. Okay. So before we get started with the insertion of the tube, I want to go ahead and check your nose and your mouth. Do you have any history of nosebleeds?
No.
Or have you ever had any surgery on your nose for things like deviated septum?
No.
Okay, everything looks good there. Now I need to just check your mouth. Ivy, can you stick out your tongue and say ah? Yeah. Get a better look here. Can you, one more time. Ah. Okay. It looks good. You're doing great. Now what we're gonna do, Ivy, is if you can kind of clear your nose for me. And what I want you to do is to close one nostril at a time and breathe out of each side of your nose. And which side feels better?
Left.
Oh, the left side? Okay, then that's the side that we're gonna be administering the tube.
Okay.
Go ahead and just drape this over you. How's your arm feeling? Everything okay?
It's okay.
Okay. Now, before we go ahead and put this in, though, Ivy, I'm going to listen to your bowel sounds for a moment, okay?
Okay.
When you
Everything sounds good. Okay, good. Very good. So you said the left nostril, correct?
Yeah.
Okay. Now I need to measure the distance of this tube that I'm going to be using. So I'm going to do that by placing the tip of it at her nostril. And we're going to go from the nostril. Might help if I turn that around. Can you see over on this side? Go here to here. So that's at 15 from the nostril to the ear. And then we're going to go down to the xiphoid process, which is right here. And I'm just at about 51. So I'm going to put a piece of tape at 51. But once you know, my partner didn't put any tape in here. So, I don't have any tape.
Oh wait.
I'm sorry. Oh yes. Let's hit that call light so we can get some tape. Here. Let's see if someone helps us out here, Ivy. Oh, wonderful! Look at that. All right. We're going to put a mark at 51 so we know where we should stop. Okay. And now I'm going to clean the tip of this. Got some cleanser here. Well, we're lubricating, is what we're basically doing. Okay. And now we're going to go in the left nostril. Can you tilt your head back just a little bit? Okay. Go ahead and insert this now. This is the left nostril. And oh, we forgot. We need to have you drinking some water. Take a sip of water there. Okay. And
Gulp, gulp.
all right, good. What? Okay.
That's enough water, thanks.
Okay. Good on the water. Now, looks like we're in there where we need to be. You doing okay? No, you shouldn't really talk right now.
It sucks.
Alright, so I'm just gonna secure this to your cheek. Okay. Well, that didn't work out too well. Okay. Ivy, I know it might be difficult, but can you just speak to me and let me know that you're doing okay?
Oh, yes.
All right. Well, now I'm going to. If this weren't a simulation, we would verify that the tube is in the correct place through by way of X-ray. Let's say that we did that, everything is as it should be. I'm now going to draw up about 5 mils of the gastric content so that we can check the pH. So I'm just gonna remove this. And I'm drawing up 5 mils. Got it? Put that back. Okay. And I'm putting my gastric content into here. Okay. And I'm now going to test the pH. So, got my pH strip here. And gonna dip that in there. Oh, what do you know? It's green. See that? It's green. And I would check this on a chart to tell me what it means. So we're basically measuring the pH of the fluid. Checking for color. And now I need to secure this. I'm gonna get 2 pieces of tape. One to secure it to the nose. So doing something like that. Go ahead. No, that doesn't seem right. Wait, this is. Alright, let's just say that was gonna stick. And then I'm gonna put my second piece of tape right here. Okay. Going to enter this information and I did my med checks. Just didn't get picked up on video. Sorry about that. But did my 3 med checks before administering the medication, and now we're gonna hook up for suction. Ivy, I'm gonna lower you down a bit, okay? Got our suction here. Just like this. I'm gonna turn this from off to intermittent. Ivy, how you feeling?
I've been better.
All right, well, if you need anything, your call light is right here. Don't hesitate to call me if you need anything, and I'll be back to check on you shortly.
Okay, bye.